Great, everyone, and welcome. My name is Dr. Lorre Laws, and I am hosting this podcast today where we will be discussing an important study that I'm going to link in the show notes that really examines why nurses are afraid to go to work or be at work. As we all know, nursing is a profession that comes with its fair share of risks and challenges. And fear is something that many nurses face on a daily basis, whether it's fear of making a mistake, fear of not being able to provide the best care possible for our patients, or the fear of being exposed to infectious diseases, many of which can be very problematic. Nurses have to navigate a complex web of emotions in order to do their jobs effectively. Recently, a study was conducted on fear that highlighted the various factors that contribute to nurses feeling fearful and afraid in their roles. The factors are some that we would expect: high patient acuity, lack of support from management, and lack of resources. And topping the list is really unsafe nurse patient ratios. This study found that fear could lead to increased stress, burnout, and decreased satisfaction among nurses. None of those findings are particularly new information, but when we examine this study through the lens of polyvagal theory and Dr. Karen Foley's middle range theory of nurse psychological trauma, well, then we can see that the fear nurses are experiencing is a strong indicator of nurse-specific traumatization. So let's unpack this important study together to see what is really going on in the nurses' health and how they're being affected negatively by fear and traumatization at work. Before we launch into these study results, though, let's quickly review polyvagal theory for listeners who are unfamiliar or are recently joining our community. So I'm going to give you the polyvagal theory, what you need to know, and I'm going to drop some images into the show notes so that you can see visually, because that for me is always so much easier than a wall of text. So polyvagal theory was developed by Dr. Stephen Porges, and it's intended to be a dynamic rather than a static theory. It means that it flows and can be adapted much like a middle range theory in nursing. And it focuses on the autonomic nervous system and how that system responds to stress, and perceived or real threats to our safety. According to this theory, the vagus nerve plays a key role in regulating and modulating our physiological responses to stress, with the ventral vagal nerve promoting feelings of safety and social connection, while the dorsal aspect of the vagus nerve is associated with shutdown responses and feelings of freezing or dissociation or disconnection when faced with extreme fear or danger. Now, neuroception is an important concept, and it's a word that Dr. Porges coined to give us a concept that refers to our subconscious ability to detect cues or safety in our environment. And that is our inner environment and our external environment, right? And this all happens below our level of consciousness. Our threat detector is constantly 24/7, every waking nanosecond and every non-waking nanosecond of each and every day is scanning surroundings for cues that might suggest that there is danger. And when it perceives a threat, well, our body's stress response is activated. In the context of nurses being afraid to go to work, their threat detector is particularly relevant. Nurses who experience high levels of fear or unsafe working conditions in their environment may be constantly on high alert, perceiving various aspects of their job as potential threats to their safety, their well-being, or their ability to provide adequate care to their patients. This constant state of red alert vigilance, again, all happening below the level of consciousness. This is a midbrain phenomenon. This is a vagus nerve phenomenon. It's an autonomic nervous system phenomenon. It is not a prefrontal or frontal cortex process. And so this constant state of vigilance can lead to all sorts of things. And we're going to talk about those symptoms and how it manifests really negatively affects our stress and our personal and professional well-being across all domains. And we're going to cover that in the next episode. But for today, we just want to understand that this constant state of being unsafe in our workplaces leads to increased stress, obviously, anxiety, burnout, and even nurse-specific traumatization as nurses struggle to navigate a work environment as well as continually triggering their threat detector and signaling that they are unsafe. And so they are in a heightened state of, flight or fight or fawning or freezing. So you might be wondering why nurses respond differently to the same stressors and nurse-specific trauma exposures. You could put, 10 nurses in a room and expose them to the same traumatic event, right? Work-related or not, and you would get 10 different nervous system responses. And this has to do with what I call your repository, which is each person, their individual and unique repository where all the unintegrated traumas are stored in the body. We know that, to quote a famous book by Vander Kessel, the body keeps score. And so trauma that is not healed at the time it occurs gets stored in the body. In the muscle, the fascia, the skin, and neural plexuses. Those are the most common places until such time the conditions are favorable for healing. So I call those that unintegrated trauma in my work, I call them unhealed bits of wisdom, because they are so wise and they will emerge only when conditions are favorable, but not always at the most convenient time and not always in the most comfortable manner. But right now, nurse conditions are so not favorable for healing in today's nurse practice settings, whether you're at a clinical site, if you're a researcher, an educator, an administrator, the system-induced trauma exposure is substantial everywhere that we work. Now, as nurses, we all know that there are negative impacts for fear and nurse-specific trauma as impacts our health. And we can start to unpack that in the various domains. So the physical, the mental, the emotional, the relational, and the spiritual existential domains. So in the physical domain, constant activation of the body's stress response system can lead to prolonged increased levels of cortisol, adrenaline, and norepinephrine, among other stress hormones, the CAN hormones, cortisol, adrenaline, and norepinephrine. I don't know if that's how you learned it in nursing school, but that's how I did. And those are intended to be very short little bursts to get us through, a saber-toothed tiger attack, but not for a 12-hour shift and not over 3, 4, 10, 20-year career arc. Right. And so these increased levels of hormones contribute directly or indirectly, among other factors. We can't unpack everything. This isn't a pathophysiology podcast, although I have taught that course. But today we're going to keep it cognitively light, and we're just going to trust that everybody remembers and knows all of the ways in which stress can disrupt and contribute to health alterations. And we all know this. All right. And so we're talking about things like heart disease, diabetes, chronic inflammation, increased risk of infection, all the usual players. In the mental domain, mental or cognitive, we can have persistent fear and anxiety. And this can lead to some brain fogginess, some cognitive impairment, difficulty concentrating, and even some symptoms of post-traumatic stress disorder as nurses cope with the emotional toll of their work environment. And so this is where it is mission critical. We can't make mistakes, but we are working in conditions that have so much trauma exposure that our bodies, our minds are being physiologically affected to where we cannot perform and execute our duties to the best of our ability. It's like practicing, with your eyes blindfolded and your mouth gagged and both hands tied behind your back. Very challenging times to be a nurse. In the emotional domain, we don't fare much better. This prolonged sense of fear and unsafe work conditions, well, that leads to feelings of helplessness, hopelessness, despair. And nurses are grappling with the stress and uncertainty of their roles. In our relationships, well, they're affected too, whether they're personal or professional. Fear can impact negatively our ability to connect with others, including our colleagues, our patients, and even our loved ones, because we're struggling to maintain healthy relationships and communicate effectively in the face of ongoing stress and trauma exposure. And then finally, in the spiritual existential domain, nurses may question their sense of purpose, their meaning, their connection to the work. Like, why this isn't what I thought nursing should be. This isn't what it's supposed to be. And it strips our healer's heart, our why we got into the profession in the first place. And it runs it through a paper shredder or steamrolls it, right? As we live in the constant threat and fear, and it erodes our sense of fulfillment and even the satisfaction in our roles. And this is all of these health and wellness alterations are huge drivers as to why nurses are leaving the profession en masse worldwide. Now, we have 18 million nurses on the planet. And the aggregate statistics go something like this. 83% of them are experiencing burnout. 91% of them are experiencing one or more symptom of PTSD, post-traumatic stress disorder, and nearly 25%, 1 in 4, meet the diagnostic criteria for PTSD. So if you really sit deeply with all of this, as I have, it becomes very clear that nurse-specific traumatization is a silent epidemic and also a public health crisis. Nurses are afraid to go to or be at work for a variety of reasons, including being afraid that their patients will harm them physically, fear of the healthcare environment, fear of psychological or verbal harm, emotional abuse, fear of being any manner of hit, kicked, hair pulled, spat upon, clawed, or having body excrements thrown at you, all of which have happened to me, and many of which I'm sure have happened to anyone who's tuning in today. It's not okay. These fears that nurses are experiencing worldwide are deeply rooted in the essential components of nursing practice, the culture of the healthcare environment, and the emotional consequences that impact daily life. These factors are negatively and profoundly affecting personal health and safety. So now that we kind of have the stage set in terms of the nurse's physiology and the context in which many nurses are working, let's now look at the study findings regarding the top fears that nurses experience. They can be understood through the lens of polyvagal theory and really examined regarding the impact to health and well-being. These fears includes concerns about patient harm, the healthcare environment, psychological harm, personal and physical harm, and all of this triggers that threat detector and puts that autonomic nervous system and that vagus nerve into a heightened state of stress response with all of the negative sequela that follows if it is a chronic situation, as it most assuredly is in healthcare, and not just nurses, all health professionals are experiencing this. I just happen to be a nurse scholar, so that's why I'm staying in my lane here. But these fears can manifest in all the ways that we discussed earlier. And so here we are, we have, physically increased cortisol levels and high blood pressure, and we're mentally and cognitively impaired, not to the point where we can't perform our duties, but certainly to the point where we can't perform our duties to the best of our ability and in the safest manner for our patients. And this is not a deficit of the nurse. This is a function of unsafe working conditions. So the list goes on with the emotional feelings of being helpless and in a state of despair, and relationally, as we have difficulty connecting with others, our patients, our colleagues, our loved ones, and spiritually, as we start to question not only the meaning of our career role, but the meaning of life. So as nurses navigate these persistent and prolonged fears and trauma exposures in their daily practice, their threat detector is working overtime, acknowledging all the other common fears that accompany us by virtue of being human, such as age and race discrimination, sexual harassment, assault, retaliation, and any other number of other workplace challenges that also contribute to a decreased sense of well-being and an increased sense of fear and anxiety. So let's talk about these other types of nurse-specific trauma exposures that are reported by fear. The fears that are reported by nurses, including concerns about leadership, physical injury and causing harm to patients, knowledge deficits, illness, contraction, humiliation, disaster response, job loss, physician reprimand, lack of protective equipment, bullying, and exposure to harmful substances. It's a big list, and it's only a partial list. All of this, and so much more indicate that there is substantial nurse-specific trauma exposure in the workplace. And many of these fears are avoidable and can be addressed through organizational support, training resources, and policy changes. Nurses are experiencing a global health crisis, a global public health crisis, one that is rooted in fear, trauma, and anxiety in the workplace. Now, this requires urgent attention and action to ensure that nurses and all health professionals are safe and professionally well in their roles. Healthcare organizations, policymakers, leaders, everyone must prioritize the mental, emotional, and physical health of the nurses and health professionals and create environments that promote safety, support, and resilience in the face of these pervasive fears, stressors, and oftentimes avoidable trauma exposures. It is critical to address these issues and ensure the retention and additional recruitment of a healthy and thriving nursing workforce that can then provide high quality care to patients and communities. But that's not what is happening now, and it is creating tremendous existential crisis for every nurse who is being traumatized in their professional role. So what can you do if you or someone you know is struggling? While the silent epidemic of nurse-specific traumatization cannot be ignored any longer, it is time for healthcare organizations, policymakers, leaders, and nurses to come together and address these critical issues that are impacting the health and well-being of nurses worldwide. Every organization is trying to be organizationally healthy in their finances, but treating nurses as an expendable, disposable commodity is very short-sighted. What is needed is a partnership so that we can address nurse-specific traumatization. And a great place to start is my nurse-specific trauma masterclass, and I am personally inviting you to join me there so you can learn how to prevent and address the silent epidemic that has nurses practicing and living in a state of fear and suffering and traumatization. Together, we can come together and create a healthier and more supportive work environment for all of us, ensuring that we can continue to provide high quality care and education and leadership and scientific contributions to our patients and communities everywhere. So please join me in taking action to address this global public health crisis, nurse-specific traumatization that is affecting nurses everywhere. I'll drop a link in the show notes. You can just go to drlorilaws.com/masterclass, and we will see you there. From my healer's heart to yours, thank you for all that you are and all that you do. I see you, I feel you, I hear you, and I am here for you. Until next time, namaste.